talking about anticoagulation, there are you can say two major anticoagulation drugs, warfarin and heparin. Heparin is actually available in two forms, unfractionated and low molecular heparin. Okay, fractionated or you unfractionated or you say normal heparin is basically having a shorter half-life, so you need to give it in the form of continuous infusion, while on the other hand you can use hello molecular heparin, where hello molecular heparin has like twice a day, so you don't need a continuous infusion for that. But the point is that heparin also has uh, heparin has two side effects. Okay, one is the hemorrhage, and the second one is very unique in a sense that heparin induce thrombocytopenia, or in other sense HIT. What is that? It is basically through unknown mechanism, it heparin leads to the activation of platelets, which what it does is actually start a procoagulative state and activation of the thrombocytes, or you can say platelets. They start aggregating themselves and the platelet number will start dropping, and it will drop like, for example, if before starting the heparin the you can say the platelet number was like 400, and after you started the heparin and the platelet number drops to like half, or you can say 200, though it is not in the basic limit of, you can say, thrombocytopenia, but because of that the number of platelets before the heparin and after the heparin has been reduced to half, it falls in the category of heparin induced thrombocytopenia. And it's a very unique situation in which there is a thrombocytopenia but there is a hypercoagulation state. Okay, so you need to keep in mind of this. While on the other hand, warfarin is that, you can say, it inhibits anticoagulation in the form of like disco 1972, for example. It will reduce the amount of these factors, factor 10, 9, 7 and 2. Okay, along with that, it also decreases the quantity of, you can say, protein SNC. What does protein SNC does? They are actually anti, you can say, thrombotics. Okay, when you are going to drop that numbers as well, which means that you are actually creating a prothrombotic, or you can say procoagulation state after inducing, you can say, warfarin. So in order to start warfarin, you had to give a starting heparin state, you can so that it doesn't. So in a sense that when you start warfarin, there is already anticoagulation, you can say, cover provided by the heparin, and warfarin takes over that. But if you start warfarin without, you can say, heparin cover, it what it does, it actually creates a procoagulation state by decreasing the amount of protein C and S, and it can even cause thrombosis. Okay, it can cause coagulation. Although you started warfarin for anticoagulation effects, but it can cause other effects, so you need to have a heparin cover before starting warfarin. And warfarin is teratogenic, so you cannot give it in pregnancy.